Hello everybody, my name is Florian Feichtner. I have been working for a clinical specialist here at Medhealth headquarters for the last 11 years, and I'm happy to share these slides with you about basic troubleshooting and cochlear implants. Okay, so when we talk about troubleshooting, that's for sure a serious business, but first of all we need to have the complete picture before we really can go into the details. So as you can see here also by this cartoon, it's not always to go on with a troubleshooting procedure right away. It really also requires a lot of information as far as the medical background or also the period of deafness is concerned. So I would like to use this schematic here to really describe troubleshooting, and as already mentioned, in many cases you need to have the background information available or before you can really start to address specific problems as far as the external parts are concerned, the internal device, and also fitting related issues which may occur. So let's first focus on data assessment before we really talk about specific issues which may occur in the field. Okay, so data assessment. So many patients address a clinician or a clinical expert when they experience a problem. So this may seem to be a bit obvious, but for our analysis it's really helpful if we also know the patient's problem, how he or she describes the symptoms. It's also helpful to know if the problem occurs permanently or intermittently. Is it caused by a specific action or when the patient is at a specific place? So is it at home or only at work or school? Or is it occurring only when the processor is used, or also when the patient is not wearing the device? From a technical point of view, it's difficult to find an explanation when the CAI user is reporting a problem while the processor is not used. So this could be related then, for an example, to tinnitus. Our Maestro system software allows us to carry out different objective measurements. So one of them is IFT. IFT stands for impedance and field telemetry. ART captures the potentials of the peripheral auditory nerve, so it records ECAPs, and also the fitting history is helpful. So as always, single measurements and the settings are not as helpful as if you have the whole history, a whole series of different measurements available. The patient information and feedback is for sure also valuable information when we assess a problem in the field. So the cause of deafness could give us an indication when a problem occurs, how long was the period of deafness, how was the performance before the CI was implanted, so especially when we talk about a post-lingually deafened patient, and how for sure is the current performance. So this would typically include AD thresholds and speech discrimination scores. Additional information we could use is, for example, here in this graph, ESRT. So ESRT stands for electrically evoked stapedius reflex threshold. So we assess reflexes in the middle ear by using a measurement probe on the outer auditory canal. Maestro also includes a coupling check tool which gives you an indication about the link strength between the external coil and the implant. Imaging could help in some problem situation to really know if the electrode array is positioned correctly or migrated over time. And last but not least, I would like to address loudness growth issues, loudness growth functions here as far as the fitting process is concerned. Okay, so really to accurately assess a problem in the field, we would like to have as much data as possible. So here with this talk, I would like now to mainly focus on the technical aspect of troubleshooting. So patient-related issues could for sure also occur. They are typically associated with medical or anatomical problems or also psychological issues. So our troubleshooting here in this talk mainly focuses on technical aspects. So let's start first with the external parts. So the external parts consist of the audio processor, which is typically the Opus 2 or Rondo. So first of all, we would like to make sure when, for example, the patient reports reduced battery life, that in the test setup, fresh new batteries are inserted into the battery frame. So we could use the microphone test device, the MTD, and the speech processor test device, which is shown in more detail on the next slide. Also keep in mind that the attraction force between the external coil and the implant is satisfactorily. So also the coil cable should be checked because it's the most sensitive part of the cochlear implant processor. So also inspect the processor, make sure that there are no cracks so that the ear hook and the housing is intact. So here I have an example of the microphone test device just connected to the Opus 2 control unit. So here you can see that with this adapter the clinician is able to listen to the microphone signal of the processor. So this is another example showing the microphone test device in combination with the Rondo processor. So in this example you need an additional the mini battery pack and an adapter cable, which allows you then to monitor the microphone signal of the Rondo via the test device. The test device itself is the same. When we assess the cable, then the speech processor test device is very helpful. So we always recommend to rotate the processor or the coil and therefore flex the processor cable and present a continuous, a constant tone. So you should see a constant flash of the red LED on the speech processor test device. If the light signal disappears while you move the processor and continuously present an acoustic signal, then this could indicate that the processor cable is faulty. So as already mentioned here, I just highlighted again the processor cable because many complaints are associated with this a little bit more delicate part. If a patient comes in and reports that he needs to replace the coil cable every 2 weeks, then I would also counsel the patient and explain how to handle the processor in a more careful way. So they should, if possible, avoid twisting the cable and make sure that the angle here is not too sharp when the coil is worn at the implant or over the implant location. The Rondo is the worldwide first single unit processor which combines the control unit and the coil in one housing. Here you can see just a nice illustration showing the control unit and footplate. the magnet and the battery compartment. The rondo is quite robust as far as mechanical stress and also sweat related issues are concerned. However, the correct handling in some aspects is also crucial. So especially when we talk about the lock here, so some CI users don't move this lock into the open position here shown on the very right, and this could also then result in mechanical damage as shown here on the next slide. So especially if they close the battery compartment while the lock is not in the open position here on the right, they could damage here this part of the footplate, of the rondo footplate. Okay, so as you may already know, the Opus 2 is also available with rechargeable batteries, which are called which is called the da capo system. Whenever a problem occurs with the da capo system, for example, if the patient reports that the battery lifetime is dramatically reduced, we would suggest this systematic approach. So if the problem is only associated with a single power pack, then we would assume that this specific power pack is affected. If it's observed with all three power packs, then maybe the battery frame is affected, possibly due to moisture or mechanical damage. As we learned from our experience, the charger itself is very robust, and it has a green light, and this confirms that it's fully operational. The fine tuner is available with both processors, the Opus 2 and the Rondo. So we always advise our patients to use the fine tuner, especially when they want to change between the telecoil and the microphone mode. However, this could lead to problems if they don't switch back to the microphone mode and then go to a different location where electromagnetic background noise is present. So this could be caused by motion detectors or also light systems, and they could then induce currents which are then experienced as background noise, as distortions. So really make sure that when the patient reports sound quality issues, that the processor is not operated in the telecoil mode, because this telecoil mode is prone to catch electromagnetic noise. Moisture ingression is a significant issue, especially in countries with a higher temperature and humidity. So the ingress of sweat and other fluids for sure can lead to a temporary decrease of performance. The processor could also just stop to work. So typically we see that if the processor is put into a drying kit or is dried with some fabric or tissue, the device is working normally again. So if you are confronted with a CI user who is having sweat related issue, make sure that the device, the processor battery compartment is only opened when or after the processor was dried with some cloth or fabric, and then that overnight the provided drying kit is used. So especially when you assess a processor, also make sure that the FM pins on the bottom of the battery frame are not affected by corrosion. So for audio processor troubleshooting, we also have some online support materials. So on our homepage there is a quick guide flowchart which could be printed out and gives you a structured solution Then additionally, we also have a more interactive, guided and illustrated walkthrough available on our homepage. So please go to medel.com/cn troubleshooting to have access to these materials. So here you can see the flowchart for processor-related troubleshooting, and here you just see how it is structured. I need to point out that it's only available in English. And here you have this interactive troubleshooting flowchart, which gives you more illustrations and hints and tips. So please refer to our online resource via our international medel.com homepage, and then go and choose via languages our Chinese homepage. So this just again shows you their interactive troubleshooting, so you always end up with questions, and there you can just click yes or no if the problem was solved or still persists. I would also like to mention the processor manual and the hard copy quick guide, which is available only in English again. The processor user manual is distributed along with the processor, and this is available in all languages. So here again, the user manual, it's really a compendium of knowledge, and also includes helpful tips and tricks for daily life and maintenance, whereas the quick guide is a more condensed format and includes very nice illustrations how to disassemble and assemble the processor, how to perform basic troubleshooting, and also how to connect assistive listening devices. Okay, so the next part of my presentation would be troubleshooting for the internal device, which means for the implant itself. So when a patient comes in at a first stage, the skin flap should be assessed. Then the coupling check could be used to ensure that the inductive link between the external coil and the implant is sufficient. You could perform a zero amplitude map if the patient reports pain or discomfort. And for sure, whenever a patient is seen, we recommend to carry out a telemetry measurement. Okay, so let's start with the skin flap assessment. So especially after the implantation, you are typically confronted with swelling, or also some fluid could reside over the implant. So make sure that the skin flap is healthy and does not show any bruises or swelling. So it's also helpful just to identify the edges of the stimulator housing. Then also make sure that not an air bubble resides over the implant housing, which may prevent you from measuring impedances during telemetry. And also make sure that the max coil retains satisfactorily when put over the implant area. The coupling check tool is implemented into the Maestro fitting software and provides you with this graphical representation of the coupling strength. So it ranges from a reddish area where you are not able to carry out an objective measurement to this greenish area here close to 100%. It also shows you the implant type and the serial number. As already mentioned, if a CI user comes in with a really doubtful problem description and you're not sure whether this is really associated with the implant or is owned maybe because of mechanical pressure from the processor coil, or also because of tinnitus, for example, Then you could just apply a zero amplitude map, either with the existing map of the patient by just here activating the map and then setting the volume to 0, and in the next step you would then lower all the MCLs to 0. For sure you could do this also from scratch when you open a new empty map and then set your default volume here to 0 while the processor microphone is activated. In such a situation, the CI user must not have any auditory perception via the implant system. If the patient still reports auditory input, then this is possibly associated with tinnitus or other medical issues which are not necessarily related to a technical problem. Okay, so as you know from a previous session, the telemetry which is implemented into the Maestro system software allows us to assess the electrical impedance between all the 12 individual electrodes and the ground typically placed at the stimulator housing. Here you see these 12 bars representing the intracochlear electrodes, and here highlighted in red you see the actual impedance in kilo ohm. So typically those values are supposed to be roughly below 10 kilo ohm. For sure intraoperatively they are lower and then over time they increase to some extent, but we would like to see that the impedances overall stabilize. The telemetry task also provides you with a status line here showing that the status of each individual electrode is okay. If there is a short circuit, then it would show you SC. If the impedance is high and not within the linearity range of the current source, you would see HI for high. But in this particular example everything is fine and we see that the impedance status is on OK. The ground path impedance is a calculated value and represents the electric condition on the remote ground, which is either a separate electrode wire with clover leaves or integrated into the stimulator housing of the cochlear implant. So typically the ground path impedance should be around 1 kilo ohm as shown here in this example. The coupling again tells you that the communication with the implant was successful. If you see coupling faint, weak or poor, that means that only part of the data was read out or no data at all was received from the implant during the IFT task. The integrity is built by checksums which ensure that the electronic components of the implant work within normal limits. Okay, so when we look at the more dramatic situation as shown in here, we see that in these examples multiple short circuits are present here between electrode 1 and 2, indicated by short circuit A, and a second group indicated by short circuit B between electrode 3, 4 and 5. Additionally, we see that basal channels number 10 to 12 return high impedance. So this means that the system was not able to drive a stimulation current through these electrode wires. So in Maestro we implemented a channel setup assistant which returns suggestions as soon as an impedance measurement was completed. So you can either accept the suggestions. In this particular example, the CSA will turn off channels here highlighted with a red X. You could also just hide the suggestions and manually activate or deactivate channels anytime. Okay, so here you see another example and the history report, which is incorporated in the Maestro system software. And again, it's always helpful if you don't look at the single measurement but can observe the whole history. So whenever the patient came to the hospital, to the clinical center for a follow-up session, then an impedance measurement was carried out. So you can see the summary here in this screen. And in the past, we can see that the impedances were more or less stable. And then all of a sudden, the latest impedance measurement returns a high status. Here you can see the latest results in more detail. So you see that here all the 12 intracochlear electrodes return high impedance. Here another example where in the past, shown here by this red line, all the impedance data was within normal limits. But now we can see that 10 out of 12 electrodes return high impedance. So this could be related to a mechanical overload caused by a bump or an accident. I would like to point out that with metal cochlear implants, it's really important to keep the surgical technique in mind. We advise to immobilize the implant stimulator housing. So here you see that during the insertion the footprint was marked, and then an implant bed was drilled for the stimulator housing and especially for the electrode channel. Okay, so to ensure that the electrode is nicely placed within a bony channel, I would like to highlight our surgical recommendations. Here on the left screen you can see an example from our surgical guide. So this illustration shows that the implant was immobilized and the electrode is nicely placed in a bony channel. Also the access loop here was put inside the mastoid cavity. Here on the left you can see a real-life example where again the implant was immobilized by sutures. If the pin variant of our titanium implants is used for sure, then sutures are not necessarily required, but a flat area should be drilled for the stimulator housing, and again the electrode is supposed to be recessed in a bony channel. Here in this example you can see additionally a fibrine matrix was used to make sure the electrode wire and also the access loop is nicely positioned in the mastoidectomy. Okay, so here I brought you a third example of an impedance measurement. Here again you can see that the measurements in the past returned rather normal impedance values, and all of a sudden you see this dramatic offset here where values are roughly 8 kilo ohms higher than they used to be. You also can see here that the ground from right to left, that the ground path impedance used to be within normal limits below 1 kilo ohm, and now it seems to consistently return values above or around 10 kilo ohms. You can also see here the latest measurement in one detailed on the right screen. So you see here also previous recordings in this table with numerical values, and up here in this red box highlighted you see that the current impedance is around 10 kilo ohm, which is way too high. So please keep in mind, as mentioned in the previous slide, it's supposed to be around 1 kilo ohm. If a patient reports no auditory perception on basal channels especially, then an X-ray or a CT scan could be helpful to assess if the electrode migrated out of its initial position. So here we suggest a Schüler or Stenvers projection, but I think it's important that this characteristic shape of the electrode inside the cochlea is nicely shown. Here in this example, so this one is the left side and this is the right ear in a bilateral case, and you can see that the right electrode here nicely follows the organization, the geometry of the cochlea. So it's probably an insertion angle of clearly beyond 360 degrees, whereas here on the left side you see that the electrode only goes into the first turn of the cochlea. So especially these basal channels are not in the inner ear. And if the patient reports no auditory perception, we could assume that the electrode migrated out of the cochlea. In such a case, these electrodes need to be deactivated. Okay, so I would like to move on now from first external parts problems, then we talked about implant related problems, and now I would like to address fitting related problems. So we do provide you with the quick guide, again only in English. So this will be available as a download on this e-learning platform as well. So the quick guide provides you with very basic suggestions to just create a fitting map and how also behavioral responses could be assessed. But first of all, I would just like to give you a quick review of our electric dynamic range, which was possibly also addressed in a previous video session. So whenever we talk about the electric dynamic range in the Medel system, we need to first keep in mind that the MCL, which stands for maximum comfortable level, is the upper end here of the electric dynamic range. There is no stimulation above MCL level. So it's the highest stimulation intensity a CI recipient will receive on this specific electrode. In contrast to that, the fitting threshold in the Maestro software is the highest level where a hearing sensation is not obtained. So in other words, the fitting threshold must be right below the detection limit. Whenever we apply stimulation on threshold, the patient must not have any auditory perception. So it's the lowest stimulation intensity the system will provide, but it must not be audible. So otherwise the patient could be confronted with artificial background noise. So again, to summarize, the MCL must be very loud and strong, but should not cause overstimulation for sure, whereas the threshold should be right below the detection limit. So whenever we apply stimulation at threshold level in the Maestro fitting software, there must not be any auditory sensation. So when we talk about troubleshooting and fitting, for sure it's a rather simple and easy task to reduce the volume or all the MCLs globally if the CI user reports that the volume or the loudness is too strong. Vice versa, we can just increase volume or MCLs when the map is too soft. Especially if patients report that auditory sensation is muffled or some of them report that they have the impression someone is calling them from the room next door, so they hear it but they can't really understand. Although they would perform quite well in an easier speech test setup, then this could indicate that especially MCLs are not adequate, are not high enough. We also recommend to keep the test volume and also the activation volume in a live map close to 100%. If the CI recipient reports that the auditory sensation is too hollow or bass heavy, then you could either reduce stimulation on the apical electrodes or also increase basal electrodes. If it's too sharp or tinny, it could be addressed by counseling, especially if you are working with a postlingual adult patient who had a long hearing aid history and was not exposed to high frequency sounds for a very long time. You need to find a compromise between good stimulation levels, which still provide also loudness cues for high frequency sounds, but are tolerated by the patient when the processor is used during the whole day. So you could just reduce the stimulation on high frequency channels in the basal section of the array to make the auditory sensation more convenient for the CI patient during this acclimatization phase. But I think it would be a midterm goal to really also bring up the high frequency stimulation on the basal channels in order to ensure good consonant discrimination. If disturbing background noise is reported, you could also try to manipulate our front-end parameters such as the map law, the HEC sensitivity, and also maybe apical MCLs if the background noise is only present in the low frequencies. However, if you reduce the gain or reduce stimulation in specific electrodes, you always take something away from the patient. So then the patient would need to change maps in those specific problem situations. If the patient is struggling with reverberation, you could reduce the overall volume. So this is sometimes observed when too much stimulation intensity is presented on all the channels. So you could also instead reduce the MCLs, which has a similar effect as reducing the volume. And you could also only address the apical channels to work or to help to avoid reverberation. If soft sounds are not appropriate, especially when we talk about aided audiometry, then it could be helpful to measure the fitting thresholds in the Maestro system. You could also increase the map law or increase the default sensitivity. However, increasing the map law and the sensitivity only would provide you a small benefit. I think if especially a patient has a narrow electric dynamic range, then it could be helpful to measure the fitting thresholds in the system software and adjust them individually. So I again would like to highlight the importance of fitting thresholds in the Maestro system as shown on the previous slide. It's important that the thresholds in the software are not audible. So when we apply single channel stimulation on threshold level, the patient must not have any auditory sensation. So by default, you can set the fitting thresholds to 10%, which is proven to be effective in the majority of all the CI recipients. However, in some cases you could be confronted with a narrow dynamic range. For example, if the spinal ganglion survival rate is low and you need a higher stimulation intensity to really create sufficient auditory loudness perception for the patient. So this is typically observed when you are working with a meningitis case. And in these cases, it could be that your AD threshold are not within normal limits. So normal limits are typically around 30 dB HL. And in those cases, you could really test the thresholds in the fitting software and make sure they are not too high, but nicely match the actual electric dynamic range of the patient. But again, keep in mind that they are below the audible range. So the 10% rule seems to work well, but in some cases you could be confronted with a narrow electric dynamic range and therefore need to fine-tune those fitting thresholds in the system software. Okay, again, a loudness growth function could be used for troubleshooting if a patient comes in for the activation of the processor and is able to report different pitch sensations when different electrodes are stimulated and has a good loudness growth or reports a good perceptual loudness growth when the stimulation intensity is increased, then I would be already optimistic that the patient will benefit from the cochlear implant. So again, you could use a loudness chart to just present tone bursts via the cochlear implant system, and on a middle term scale, these responses should be here in the very loud range for MCL, because we really want that our electric dynamic range is well adjusted to the true perception of a patient. So a very loud sound later on needs to be at a corresponding high stimulation level. So in some cases we saw that CI users were just adjusted to a medium level while single stimulation bursts were presented, and consequently then the live map was not loud enough. So please make sure that the MCL, which stands for maximum comfortable level, is corresponding with a very loud and strong sensation, but for sure does not create overstimulation. It's not supposed to be above UCL, uncomfortable level. It should be in an ideal case right below. For sure, you won't be able to achieve that in a first fitting situation, but when the hearing performance progresses and the map stabilizes, the MCL should create a strong and loud hearing sensation. Okay, so troubleshooting could be a very complicated matter. So we have the fitting guide available, but please keep in mind that it's a very individual process. So whenever you apply changes, I would recommend to not change too many fitting parameters at once. Otherwise, it could be difficult to really see if there is a benefit or not. Many or some aspects are also related to counseling. Some CI users don't have realistic expectations before they are implanted with a cochlear device, with a cochlear implant. And in many problem situations, you really need to follow a trial and error approach. We can't provide a systematic troubleshooting guideline for each and every situation. Okay, so just as a take-home message, really always have the whole picture in mind when you are confronted with troubleshooting. First of all, data assessment is very helpful, as more background information as available, the better. And then if you really know when, where, and under which conditions a problem occurs, you could start either with external parts troubleshooting, implant related troubleshooting, or also fitting related troubleshooting. Thanks for your attention, and I hope to see you soon again here with Medel.